That was the first suggestion that he gave. So when they came the second time, they still went into a light state, but it was compounded. When they came back the third week, it was compounded again. And the fourth week, it was compounded again. And the fifth week, and by, the compounding took effect, and they got the deeper state of hypnosis. But just as Bernheim found out the power of the compound without knowing enough about hypnosis to call it that, when I discovered the power of the compound and put it to use in medicine and dentistry, now doctors were able to get an anesthesia, which I can tell you has been astounding in this respect, that as a teacher, when a doctor comes to you and says, Mr. Ellman, I'm in anesthesia, and last week using hypnosis alone, I was able to get an anesthesia so deep that it would have frightened me had I not known what caused it. That's the words of an anesthetist. And when an anesthetist speaks like that, a man who has infinite respect for anesthesia says to you that he was able to get the deepest anesthesia he ever obtained in his life, and yet he was using nothing chemical. He was merely using the power of suggestion. It explains to you also why delivery in the coma state is possible, because when they are compounded to the point where they reach the coma state of hypnosis, the anesthesia is so complete and entire that they actually feel nothing, but can maintain a smile during the entire delivery period. Now, if you've ever seen a woman with a half smile just frozen on her face like this, and she takes the contractions just as though they were gentle little waves, and she takes the crowning, the episiotomy, the delivery of the baby, the expulsion, the expression of the placenta, all of it with that little smile on her face, as though she's enjoying every minute of it. And the second that the baby is born, before the episiotomy is repaired, before the placenta is expressed, the instant she sees that baby, her eyes open, and she sees that baby and that big, broad smile, I tell you something, gentlemen, it is one of the most thrilling things you will ever see in medicine. And you will be able to do it for these women. Simply because of what? Because you know the secret of compounding. What does it mean to the dentist? It means this, that you can get an anesthesia in dentistry as complete as any xylocaine ever got it, and as complete a general anesthesia as you want for multiple extractions, providing you use the theory of the compound correctly on the patient. There's only one thing that you have to fear now, and that is fear itself. You eliminate fear, you are bound to have a perfect result. Now, this is in every case. Gentlemen, where you don't get a perfect anesthesia, fear is present. Fear is present. Many years ago, a student said to me, I think a person accepts the anesthesia of hypnosis in direct proportion to the way they accept the state. And I said, yes, doctor, in accordance with how much fear they have regarding hypnosis. The instant you eliminate fear, then you have this wonderful state in which these wonderful things are possible. Now, let me show it to you on another patient, then I'll show it to you on a doctor, and then we'll start practicing. And it will be the job of every doctor to do the following things. First, produce true somnambulism by the repeated induction technique. If he encounters artificial somnambulism, change it to true somnambulism. Secondly, once he has the somnambulism, he is to go after somnambulism with the eyes wide open. That means that you must give a suggestion in somnambulism which holds over when the eyes are opened. Once the eyes are opened, compound the suggestions until you have a depth of anesthesia which satisfies you as a student is medically or dentally useful to you. Now, what other little lady back there would like to have the experience of the little lady who came up here a while ago? All right. Now, what?
I might say that she hasn't had anything but hypnosis for her nausea training.
Well, then that's wonderful. That's wonderful. And then it helps a lot, doesn't it? Sure. Then you know how much it'll help in actual delivery. It can be you can have this baby so beautifully that you'll enjoy every minute of it instead of dreading it like other mothers do, you know. And you know, this lot of nonsense that has been taught for years and years and years, that a woman must have pain when she has a baby, is just absolute drivel. Because I don't think that there's any people in the world that study the scriptures more. I know there's other people study them as much, perhaps, as the Catholic Church. But remember that every bit of our techniques has been okayed by the Pope and by the Catholic Church. And so if there was nonsense to what we're doing, it would not have been okayed, nor would we have had the help of St. Francis Hospital and the Chicago Diocese at Milwaukee in the making of the picture which shows conditioning and delivery in the coma state of hypnosis. The Catholic Church wouldn't have allowed it. So when I tell you that it is within your church's province, it is within your province, and it is within everyone's province to have a baby painlessly and get over the notion to the whole world that you have to suffer just because you give birth to a baby. You don't have to. It can be just as easy as any normal bowel movement. That's how easy having a baby can be. Nature is right there to help you all the way through. And if man had only realized that, this delivery in the coma state would have been known about thousands of years ago. Well, just take a good long deep breath and close your eyes, please. Now relax those eye muscles to the point where they just won't work. When you're sure they won't work, test them and make sure they won't work. Let yourself go deeply relaxed. Now right down to your toes. Now in just a moment, I'm going to have you do this over again. You're going to relax 10 times more than you've already relaxed. Now open your eyes. Now close them. That's all right. Now she's already, we're going to shortcut this and we'll get her right down to somnambulism. We'll just let that hand be in your lap. And when I lift it, it'll just be limp. Limp as a dish rag. And don't you lift it at all. Let me lift it. You know, let it be heavy. That's it. That's what I mean. That's it. Now we've got the physical relaxation. Now go for the mental relaxation. Start counting at 100. We've given her the equivalent of 3 visits to Bernheim now. I shortcut it. That's what I did. Start counting from 100 backwards and make the numbers disappear. Now, relax completely and watch them disappear. Now they'll be gone. A nice feeling? Now we have the somnambulism. And now we have the patient ready for the next suggestion. Now here is suggestion number 1. And I'm making it a simple suggestion. I'll just lay your hand on your lap like that. I'm going to stroke that hand, and you're going to get some numbness come into the hand. 1, 2, 3. How's the hand? Feel it now. Feel it coming. When I have you open your eyes, that numbness will increase 10 times over. Now open your eyes. Now this is somnambulism with the eyes wide open. How's the hand? Don't feel anything there, huh? A little. All right. Now we want that anesthesia to get 10 times stronger. Tilt your head back and bring it forward, and notice what happens to your hand. How's your hand? Better yet. Do it again, and that anesthesia will become so intense you won't be able to feel anything there. Oh, it's pretty numb now, huh? Now, the very same thing is true here. She won't feel a solitary thing in that hand. And I'm going to make the same test. I'm going to let you see that neither she nor the girl before her nor anybody else, once suggestions are compounded, can make a very good appraisal of where the test is made. That's how good the anesthesia is. I'm going to be working on this hand here. You'll know I'm working there, but nothing will bother, nothing will disturb. Now, without opening your eyes, try to locate where that test was made. Notice that, gentlemen. Every place but the right place. You notice that? Now, we want that anesthesia to be profound when she opens her eyes, because I want to ask her a couple of questions about it. Open your eyes, please. How's the hand? Pretty numb now, huh? What'd you feel of what I did? What? Didn't hurt. You know that I was taking a little nip or something, is that right? But it didn't bother. Could you tell there was any pressure there? No. Well, not enough to amount to pressure. In other words, you can remove the sense of pressure with many people with the depth of anesthesia which you get by compounding. This, I think, should be very valuable to you, because in your work, most of your work is surgery, isn't that right? Yeah. Those of you who need a very good grade of anesthesia will find that compounding enables you to get it, because we're not only talking about delivery, we're talking about every type of work. Now, suppose we want to bring that anesthesia someplace else. Put your hand right on there. In about 3 seconds, that anesthesia will transfer to the other hand. Now put your hand on the other side, and you'll find that there's just shifted hands. How's the anesthesia in your right hand now? It's there. In other words, we can put that anesthesia any place. She's got it in her right hand now. Put it at your toes, would you please? Just touch your toe with your hand, would you please? And just hold it there for a couple of seconds. How the toes feel? No. In other words, this is an anesthesia where you can bring it any place on the body at all. Any place. It doesn't matter where. If you have to do work that would ordinarily be uncomfortable to the patient, put that same anesthesia up at your jaw. Watch what good dental anesthesia you get. How's your jaw? Right? Real numb. There's what I mean by it, gentlemen. You can move it all around the body, and if you have to work in dentistry, we'll say, on both sides of the face. Well, watch. It's up here now. I want to bring it around to the other side. That's all I have to do, and there it is. How's the left side of your face now? No. In other words, this is anesthesia you can work with. This is something that you can understand, and what have I been doing? Do you get what I've been doing? I've been compounding. So therefore, the anesthesia up here now will be stronger than the anesthesia she had in her hand, because there's been about 4 or 5 compounds since that time. And to let you see the depth of the anesthesia, Doctor, I believe you're going to find the most amazing anesthesia you probably ever found in your lifetime now. Watch the depth of anesthesia here. Beautiful anesthesia, right? Isn't that beautiful anesthesia? Now, when you get an anesthesia as good as that, that's pretty good to work with. And I want you to see what he worked with. Now, did you see what he worked with? What'd you feel? Nothing, huh? What? A little bit, not much. Enough to know that he was in your mouth, but not enough to bother. Now, suppose we want all that anesthesia to disappear and every part of the body to feel wonderful. Close your eyes. When I snap my fingers, that anesthesia will disappear. When I have you open your eyes, you're going to feel better than you felt all day. And so when I have you open your eyes, you're just going to feel wonderful. Open your eyes. How do you feel? Where? All the anesthesia gone, everything? Okay. You're done, don't you? Okay, thank you so much. Now, there is a wonderful patient. And we know that she will condition for delivery in the coma state beautifully. Why? Because she takes compounding so well. So will the other lady who was up here before her, because she took compounding just as well. Are you beginning to understand the thing which makes hypnosis work? That from the beginning of hypnosis to its deepest stage, it is all a matter of compounding, and that once you know the art of compounding, you know all the so-called mystery of hypnosis. Because all you're doing at all times is developing a better state, a greater depth, and a greater anesthesia if it's anesthesia that you want. Now, but I want to show you something else about this. At no time do people in hypnosis lose awareness. They aren't zombies under someone else's control. The little lady who was just up here, would you like to come back here? I'd like to show them a little experiment which will let you see that in hypnosis the patient has greater awareness than she could possibly have under normal circumstances. You're not too old, a young lady. Do you remember when you learned how to walk? Do you think anybody in this room remembers when they learned how to walk? Would you realize, perhaps you don't, but would you know that in the state in which we just had you, we can let you see yourself learning how to walk again? That you actually remember. You see, people have a funny idea about life. They think that you just forget things. Nobody ever forgets anything. Everything that we pass through in our lifetime makes an impression, and we store it away. But when awareness is sufficiently increased so that we can pull that little remembrance out of its drawer, out of its hiding place, you get a very thrilling effect. Every person in this room doesn't know it, and if you ask them, can you remember back to the time when you learned how to walk? You'd say no, but every person does. Let me show you that concealed within this person that we have up here, and I don't even know her name, is the memory of herself learning how to walk. And if you would like to see yourself learning how to walk again, and see the people that were there, mother and dad, and brothers and sisters, if you had any. Do you have any brothers and sisters? All right. You'll be able to see them as you were learning how to walk. Close your eyes again. Make the numbers disappear, and you'll be right back in the state in which you were before. Numbers all gone? Make them disappear. You can do that right away. All gone? All right. That's right. Make them disappear. They're all gone? Now, here's what's going to happen. I'm going to open that drawer for you, or help you open that drawer, in which is stored the memory of you learning how to walk. I'm going to snap my fingers, and you will see an actual vision. It'll be an actual memory of yourself learning how to walk. And if it was an interior scene, you'll see the furniture that was there. You'll see the people who were there and how they were dressed, and you'll see yourself and how you were dressed. If it was an exterior scene, you'll be able to tell us what time of the year it was by the weather. And not only will you be able to tell us what time of the year it was by the weather, but you'll be able to tell us how you were dressed and how they were dressed and what was said. So when I snap my fingers, you will have that vision. When I snap it the second time, you will open your eyes and you tell us what you saw and the words that you heard spoken. All right, now here it is. And now when I snap my fingers again, you can tell us all that you saw. There it is. Now you can open your eyes. What'd you see? You saw a couch. Mm-hmm. And where were you? You were in the middle of the floor. Were you standing or sitting? Sitting. And what happened? What?
I walked to the couch.
You walked to the couch. What color was the couch? Red couch. And who was there beside you? Mother. Did she look a lot younger than she looks today? And you noticed how she was dressed, didn't you? How were you dressed? In a little yellow dress. And now in your mind's eye, because you can remember it, take a look at your mother and tell us how she was dressed. You can close your eyes and see her. There she is. There's the dress she has on. How was she dressed? If she had a dress on. What kind of a dress does she have on? What color is it? What? Light, sort of a off-white, is it, or a white, or is it a print, or what is it? It's a print. And it's got various colors on it in addition to the white. Is that right? And how does she look? Does she look nice? Is she helping you to walk, or are you walking all by yourself? All by yourself. All right, you can open your eyes now. How does it feel to be able to see yourself walking again? Huh? It's a funny feeling to think that you have a mind that good, isn't it? But remember, every person in this room would be able to do the very same thing. This idea that you could do it under normal circumstances when you have 100% awareness, oh no. But when you have the awareness brought on by the state that the young lady is was in or is in, I don't know which at the present time, because I'm going to remove the suggestions, but she'll still be able to remember everything. Close your eyes, please. Now, when I have you open your eyes, why, you'll just know that this is a very pleasant thing to be able to remember, and all the suggestions I gave you about this vision and so on will be over, but you'll remember everything very clearly and notice how good you feel. All right, you can open your eyes now. How do you feel? Can you see what I mean by awareness increased? I could also bring her back to the first remembrance she ever had when her intelligence formed. The first impression that ever remained on her after her memory formed. But we'll do that when we get into hypnoanalysis. This was merely to let you see that the state which we develop is one of keen awareness and not unawareness. It is not unconsciousness. It is not a state that you have to fear. This is a state in which your mind works so well and the law of self-preservation works so beautifully that no one could ever take advantage of you in the hypnotic state. And that is why in the history of the world no injury or damage has been done by hypnosis. You see, you read the wrong books about this subject, and you hear the wrong things about this subject. And they don't know how to explain these things, so they infest it with figments of their own imagination. My wife says she doesn't like me to use the word infest because it sounds like germs. Well, that's exactly the way I think people have done with hypnosis. They've infested it with a lot of germs, a lot of false ideas, a lot of lies that are incorrect. It is perhaps one of the most beautiful states that God has made possible in mankind. And this beautiful state, nature's own anesthesia, which he makes available to each and every one of us, has been abused sorely by people trying to make it voodoo and black magic. It's none of those things. It's a beautiful thing. It's just like some people have an idea that sex is a horrible, terrible thing. None of us would be here if it wasn't for sex. Sex is a beautiful thing. It's all the way you're taught to look at these things. Taught to look at hypnosis properly. Hypnosis is a very beautiful, wonderful thing that nature made possible. Taught to look at it through the eyes of an Alvarez, a man who is poisoned by his own thoughts and who infests hypnosis with those germs that he has. Oh. And that is why when I read these articles by these people who don't know hypnosis and who are not able to do things with hypnosis and then see a man like myself doing these things with hypnosis and think something magic about him. There's nothing magic about me. Nothing magic. I don't even know magic. All I know is how the human mind reacts under certain conditions. And the condition which I have studied the most is this state, which is so beautiful, which is so lovely. Well, you've had it. Is it lovely? Here's a thing which has helped her get rid of her nausea and vomiting of pregnancy. Should she look at this thing as something bad or ugly? Should she look at this as something frightening? No. She looks at it, she has the right attitude. It's something lovely. Here's something which makes it possible for her to remember when she was a baby less than a year old, perhaps. Should she not look upon it as a wonderful state? Should there be any fear with it? There should be no fear with hypnosis, but sad to relate, let fear enter in, and even the wonderful states that you've seen tonight can be ruined by fear. That's why don't let fear enter in. Don't let a nurse or a doctor around who doesn't know the semantics of hypnosis. My God, she's not going to have all her contractions and everything without any anesthesia at all, is she? And that's, you know...
My patients usually do it anyway, but I figured I'd give them more help because they want natural.
Sure. But this lets them have natural childbirth at its most beautiful, beautiful state.
Usually I give it some dirty jokes. This way I can give it.
You can get it too. Thank you so much. Let's start with you tonight, huh? Would you come up here, please? Because I want you to see just what I do with you, and I want you to feel these surges of anesthesia as we compound suggestion. That's the reason. You might wonder why it is that we have the doctors practice on each other and know everything that they're going to put their patients through. Simply this, that I have long been of the opinion that the reason so many mistakes crept into hypnosis is that thousands and thousands of well-intentioned men studied hypnosis from the outside in instead of the inside out. Now, when you look at hypnosis from the outside in, you have to fill it with your own imagination. But when you look upon hypnosis from the inside out, you know what the inside of hypnosis is like, and you lose your fears of it. That's why, in working, I like the doctor to know what he's going to do to his patient, and to let him know what his patient is thinking and sensing and feeling, and how little he is feeling. I want you to feel the anesthesia of the compound, and how beautiful that anesthesia develops, doctor. Close your eyes. You can get eye closure instantly. And look, we're going to shortcut it. Instead of giving you 3 visits to Bernheim, I'm going to give you 1 visit to Bernheim, and as I drop the hand, the numbers will disappear. But when you practice, don't do it that way. I'm just doing it because I know you can make it happen that fast. Numbers gone? All right. Now he's in the very same state by shortcutting that the 2 young ladies had. So now we're going to do the very same thing. I don't want you to develop complete anesthesia at this point. I'm going to stroke the hand 3 times, and you'll feel some numbness, but it won't be anywhere near complete. 1, 2, 3. How's your hand? Feel it started. All right. When I have you open your eyes, I want you to feel how that numbness increases. It'll be about 10 times stronger. Now open your eyes. What happened to your hand, doctor? Getting numb. Now, put your head back. Bring it forward again. Any suggestion I give him, it doesn't matter what. I can say I'm going to light this cigarette, and his hand gets number. Can you feel those surges, doctor? Now, raise the right hand and lower it, and feel how numb the left hand gets. How's the left hand? Right? It's getting real numb. Now, you feel each surge. You know what I mean by the compound now. And you know why you've been able to get these results. The reason you were able to succeed with hypnosis the first couple of weeks you used it is the fact that inadvertently you stumbled upon the secret of compounding but didn't realize what you were doing. You see now how you made those, not those mistakes, but those very wonderful things happen. And when I was amazed, I said, how did you stumble on the secret of compounding? How did you make it happen? But you can see now that's what you did, can't you? All right. When I have you open your eyes, that anesthesia will be gone, and you'll just feel better than you felt all day. You'll be able to use this procedure on others. All right, open your eyes. How do you feel? All right. Now, doctor, now you know what happened when I met you downstairs in Pronto restaurant, remember? And you were telling me about what you've been able to do the first couple of weeks. And I said, hey, wait a minute, you're going way much faster than the course allows. And I said, you must have stumbled upon a secret of compounding that you don't understand yet. But when you got those results, can you see now what you were doing?
Yes, I can.
And you can see why you got it. You gave the first suggestion and kept hammering away with other suggestions until the first suggestion got so strong that he was able to deliver babies painlessly on the first session, on 1 session. And usually I tell a doctor, hey, don't do that because you're way ahead of yourself. But isn't that correct, doctor?
I had two right after the first session.
Yeah. Now, what happened is that he was compounding and not realizing it. Now you see what you were doing. Is that clear, what you were doing? All right, let's take the next one. Will you come up, please? And now, doctor, will you compound on him, and I want him to see what somnambulism is like with the eyes wide open and so on.
Good relaxation. Take a deep breath. Let your eyes close. Little portion, let your eyes close. Let your eye muscles relax. Let the eye muscles relax so that the eyes won't move. No matter how hard you try, the eyes won't move. Test them hard. That's fine. Now let that relaxation go from the top of your head or down to your toes. That's right. Now go all the way down. I'm going to test you here. Just let me lift the arm. Just let it drop.